Hello, everyone, and thanks for joining us. Questions continue to pour in over the Ebola outbreak.
Speaking at a forum Saturday in Brooklyn Center, Congressman Keith Ellison says he will get answers to questions local residents have. Cassie Bonstrom joins us now with more. Cassie?
Well, Ellison is calling the Ebola virus a bigger threat to the United States than ISIS. And while we need to be better prepared here in the U.S., he says we need to also be aggressive in treating it in Africa.
I've been very clear that a travel ban is the wrong policy.
Representative Keith Ellison spoke to a crowded room at the Brooklyn Center Fire Hall, sharing his ideas on how the U.S. should contain the deadly Ebola virus.
Because if we just try to wall ourselves off here in America, it's completely callous and insensitive to the people of West Africa who are suffering. But it also is going to get to us eventually.
Ellison called for better training for nurses and doctors at Minnesota hospitals.
There's a lot of ignorance out there about Ebola.
But said trained medical professionals are especially needed to volunteer to travel abroad.
Best strategy is to stop it where it is now so that you don't have to fight it in Minnesota later.
Many in the audience agreed and showed interest in going back home to help, but had questions for the congressman about what would happen when they return.
A lot of us have immigration issues.
I'm going to go as an individual, but my family is going to be here. When I get back, will my job be available?
Right now, we're developing what to do.
Ellison promised to take all of their questions back to government and health officials.
This is something we're working on, but we don't have clear answers for it yet.
Without answers, however, many said going back to Africa to help is a risk they simply cannot take.
It's a sacrifice, and a lot of people wants to do it, but there has to be some homework done on those fronts.
Another big concern was whether volunteers who put themselves in harm's way to treat Ebola patients would get the same medical treatment here if they, too, contracted the disease. Now, again, Mike and Alex Ellison and other health officials promised to come back with concrete answers to all of their questions.
All right, more to come. Thanks, Cassie.